So let's go to today's class with introducing to pathology. Means what will be learned in this semester, in this class. What means pathology? So pathology is the study of the illness. We have a class last semester. We talking about physiology. Physiology. So I think you start learning basically for Western medicine anatomy, then physiology, then pathology right now. What's the difference for this class? For this few class. Anatomy, talking about the structure of the bodies, like talking about the name and the location, about the bone, about the muscles, about organs, blood vessels, nerves, something like this. And the physiology, physiology. We're talking about normal function of the body. Normal function. Like how our body working, how the heart jumping, blood circulations, how our digestion working, digestion for different kind of nutrition, and how our urination systems working, how the urination producing, how our nervous systems working. So all belong to normal function. Now when we go to pathology class talking about abnormal kind of condition. Abnormal kind of condition truly is the illness. So when we're talking about illness, we are not truly talking about too much like clinically, like the symptoms, like how to treat it. So that part will be in your later, like you have internal medicine class, 门类 lot of illness you will talk about. So pathology class, basically we're talking about like how it happens. We study like how it happens during the illness. It's not truly clinical relationship with the illness. So that's our pathology generally. Pathology generally. So we discuss the illness from 4 aspects. These 4 aspects, we're talking about etiology, like what's caused the illness. No people like sick, but what's caused people sick? What's caused the illness? So that's we say etiology. Etiology. Then we're talking about pathogenesis. Means like we have some reason cause the illness and how illness happens or development. After people got illness, then we discuss the changing of the bodies. Like during the illness, what kind of changing will be happens? So this kind of changing we separate two aspects. One changing is the shape changing, like the cells changing. Another aspect is the functions changing. Function have some disorder. So that's basically together we talking about we have four aspects we study and learning for the illness. That's our class for pathology. We say we study from four aspects of the illness, like what caused the illness, how the illness development, and what kind of changing will be happens during the illness, including the shape changing, including the function changing. So the first level we talking about etiology. Etiology means what caused the illness, the reason for illness. So cause for illness, lot of reasons. Yeah, lot of reasons. Which is separate with two mainly big categories here. So we say the illness may be caused by genetic reasons and may be caused by other reasons. Or we can thinking about environment reasons. So genetic reasons, that usually is genes problems. Like the genes coming from the moms or dad, they have some disorder. And then when the new babies coming, they will have some disorder. So that's one big category. And another big category, we're talking about the baby is totally healthy, yet nothing happens. But follow the baby grow up, like go to young people, go to old adults, and then for some other reasons, infections, like nutrition reasons, chemical reasons, or maybe physical reasons, whatever, just after birthing and get illness, not belong to genes disorder. So that's all together, we call it accurate category. So that's truly two big categories. So as we know, we say this kind of illness, we know what caused it. It was caused it. So that's we say primary etiology. But truly some illness right now, we don't know what caused it. What caused it. So we are not specially discuss the illness. We don't know the reasons because we couldn't discuss. We don't know it. We don't know it. We only discuss the illness we know was caused. Then we separate with two big categories here. Why is genetic reasons caused? Why is not genetic reasons caused? So that's the two big categories we're talking about etiology. Then generally speaking, when we discuss pathogenesis, that means how the illness like with the cause, and later on how they development clinically. So we say we have some reason cause the illness, but clinically they may not immediately, like people getting sick or illness. For example, we're talking about cancer. Cancer, right now we still not totally understanding, but at least we know, like a lung cancer kind of patient, pretty close relationship with people smoke. Yeah, people smoking is more risk people getting lung cancer. But it's not like you just smoke one cigarette and then you got lung cancer. It is gradually take a longer time, and they damage lung functions, and then getting more severe, and finally lung cancer is show up. So that's we discuss for the illness. We discuss how the illness development and what cause like shape changing and finally the function changing. So that's we discussed in this class also. And when we talking about something caused the illness, they will changing the body from two aspects. One aspect is the shape or structures changing. That's basically start happens in the cell or tissues. So last semester we talking about cell and tissues. Yeah, still remember, cell is the smallest living unit, and the similar cells, group of the similar cells together, that's we call the tissue. Yeah, that's we call the tissue. So the changing start from the cells and the tissues. Yeah, certainly cell changing, tissue will be changing, because tissue is composed by the cells. So that's basically the changing, gradually getting more severe and severe. But in this stage, maybe the changing we only can find with microscope, like the cells, pretty smaller, like tiny smaller. So even they changing already, you still couldn't use your naked eyes. Even tissues changing, yeah, you still may not see with our naked eyes. But when they getting more severe, yeah, and more changing, then truly, you can see it with naked eyes. So that's we talking about like the organ levels changing. When the structure are changing in the organ levels, truly we can see with our naked eyes. For example, some people got heart failure. Their heart getting pretty bigger, and they changing the shape. They're changing the shape. So then we can see it. Yeah, then we can see it. So finally, we got the function changing. When people's function changing, that's pretty like severe kind of condition. And it can cause a lot of clinic symptoms and signs. So we say the functions like the basic one depending on the shape normal. When the shape is changing and they affected the normal functions of the organs. So that's clinically, we can see the symptoms and the signs during the illness. So symptoms, last week we talked about, that's patient itself can feel abnormal kind of condition. Signs is practitioners or doctors can see, can checking, find the abnormal signs in there. So that's basically we're talking about pathology. We including four aspects. Yeah, four aspects. What caused the illness? How the illness development, and then the illness happens, their shape will be changing, structure will be changing, and finally, function will be changing. So that's of our pathology. Then we still go to more detail about pathology. Yeah, more detail about pathology. We still go to firstly, what's the cause of the illness? We say cause of the illness, we separate with two big categories. Yeah, two big categories. We only discuss the illness we know was caused. We don't discuss the illness we don't know was caused. So in this category, the illness we know the reasons, we separate with genetic reasons and other reasons. Other reasons, just the environment reason. Yeah, something around us and can cause. And truly clinically pretty common. They may have combination reasons. So that's we talking about some illness. Right now we know high blood pressure. That kind of patients, if you ask family histories, usually they have father or mother side, or maybe auntie, uncle side, will have the similar high blood pressure history. So that's pretty common. But it's not means everyone, their parents have high blood pressure, their children must be have high blood pressure. Something relationship in there, like these kind of people easily got same illness, but not everyone. Like during the brothers or sisters, maybe like in the family they have 5 children, maybe 3 or 4 of them, they have same illness like their parents, but still have 1 or 2 they don't have. So that's we talking about combinationally genetic reason with environmental reason. And a similar case also for some cancer kind of patients and the families. So that's we say cause of the illness. Generally we say we separate with 2 categories. One is genetic reasons, one is environmental reasons, but possible both. Possible both. Then we discussed environmental reasons. Environmental reasons including lot of aspects. So we just try to make it a group here, and then we discuss some detail here. The first physical reasons. Secondly, chemical reasons. Then we talk about nutrition reasons, and then maybe some infections, and immunity disorder, and also mental disorder. So that's basically mainly reason cause people for illness, for environmental reasons. So let's discuss the reason here one by one, go to some detail. The first we talking about physical reasons. Physical reasons, like sometimes some trauma, people injured, like with a knife cut the fingers, or maybe people falling down, kind of trauma can cause certainly, mostly locally, like a swollen redness in there and people in there. So that's physical reason. And the radiations. Radiation belong to physical reason. Radiations, usually we're talking about like some X-ray. But recent years, like the technique, more and more development, we have more radiations right now. Even there's still small amount in there, but truly still belong to radiation. And also including like a CT scan, even MIR. But their amount pretty small if you are not like pretty often go to check, go to examinations for X-ray, CT scan, you still safety. But we especially talking about like for pregnancy. Yeah. When people pregnancy, the babies is pretty weak. The baby is pretty weak. So pregnancy women, when they go to X-ray or CT scan, basically we try to checking for the abdominal area. We put some protection for the abdominal area. We can check in other part of the body, but not for the like sphincters area, because the sphincters pretty sensitive for the radiations. But truly, big radiations can cause people sick. I think I heard a story. It happens in Japan, I think. Some people pick up something looks pretty, yeah, pretty special, yeah, like a ball in there, and pretty light, yeah, pretty light, pretty nice. He just put on the package, yeah, on the package. But on the same day, got a severe kind of abdominal painful, and also fever, nausea, vomiting, lot of like symptoms show up. And later on, sending to the hospital and checking, and finally found that kind of belong to some like radiation kind of source in there. For some instance, just missing and go to the earth, and that people pick up. So that's severe kind of radiations. That's truly get people sick. And also we're talking about some other physical reasons. Yeah, some other physical reasons. So temperature extremely changing. We say our body temperature normally around 37 degrees, 30 degrees. But we can suitable for living for ourselves. Maybe like right now outside is about 5 to 6 degrees, 30 degrees, but you still need to put clothes on. Yeah. And the hair part, usually your body can handle less than 50 degrees. That's the range. In there. But if some people go to outside like a minus 20, 30, or even 40 degrees, if you are not truly protected your body will be injured by the pretty low degree. Like people go to outside walking in the winter, in the snow, they losing the way, go home, they just walking around, and finally they go home. But their feet is like injured by the low temperature. And some people just cut of the feet, because if the tissue is dead there, we will talk about the cell size later. If tissue is dead, if you not cut off it, they will go to gradually go to like infections and go all over the body, people possible death. So that's by the low degree. By the high degree, like some people burning by the hot water or burning by the hot oil. So immediately immediately. Redness, painful, even some blisters show up. So that's the temperature, extremely kind of temperature, truly can cause the people sick or illness. And electrical, electrical. Thus we know we couldn't directly touching the electrical with our hand or feet. Thus can because the like some electrical will pass in people's bodies and damage like internal tissues. Severe kind of case, people can immediately getting died from the electrical. So that's all of these, belong to physical reasons, physical reasons. So these kind of physical reasons, they can damage people's bodies. Could be immediately, some reason immediately, like a trauma, like electrical. Some reason may be gradually, but finally they still cause the like tissues or cells injured and dies. So that's physical reason. That's physical reason. Then we're talking about chemical reason. So chemical reason including lot of stuff. So for example, even we're talking about the medication, like the drugs, those still belong to chemicals. Like some people use medications or drugs for long term. Truly, they will damage our internal organ, mainly is the liver. Some medication or drugs may damage the stomach. So that's we say chemicals. And the chemicals also could be in the industries. Like some special kind of stronger acid. That's truly directly like damage the part, body touching part. Like some people by accident touching the stronger acid and immediately can get the hand is injured. Pretty similar like burning. But sometimes even severe than burning. So that's some stronger acid. And also something at home. Some chemical still can injure. So that's basically, we have a lot of chemicals, different kind of chemicals. That's toxin to the cells. They can cause the cells injury. They can cause the tissue damage. And they can finally cause some special organ is injured or damaged. So like we talked about before, people use drugs long term, and also alcohol. Alcohol still belong to chemicals. Any kind of alcohol go to inside the body, it will go to the liver. Like last semester, we talked about liver function. Liver have lot of functions. One important function is detoxins. So all the chemicals is belong to toxins for the body. If you truly use for long term, or maybe short term big dose, we talking about like alcohol damage the liver. Some people for long term they drink alcohol like every day, high degree alcohol they drink. Like after few months, after few years, the liver function is damaged. But we heard about some people only drink one time, but just a big amount of alcohol and cause the people coma or even death. So depending like how big amount you drink and how strongly that kind of chemicals. But truly, even small amount, too long time, and gradually it accumulated inside the body, still possible damage. So that's one organ is pretty easily damaged in the liver. So all the chemical, all the toxin, there are metabolism in the liver and they released in the kidney. But if you use too much amount, so truly, liver will not able to deal with that kind of big amount of toxins, or even they can, but still like a liver need overworking rate. So that's still possible damage liver's function. So that's for the chemicals. For the chemicals may cause the injury. So that's the second reason we say cause the illness. First reason cause the illness. Physical reason could be immediately injure locally cells and tissue. Secondly, we say chemicals. Chemical can injure the cells, tissues, or maybe injure the organs. Now we're talking about another reason will cause the illness. So the third reason will cause the illness, relationship with the nutrition. Nutrition cause the illness will go to two aspects. One aspect is deficiency. One aspect is excessive. So when we're talking about nutrition deficiency, usually it's a relationship with like people don't have enough food to eat. So like in Africa, some children, sometimes you can see like some on the TV some children in Africa, they are pretty thinner bony, like no muscles, because they don't have enough food to eat. So that's one reason. But truly, some people, they have enough food to eating. Yeah, they have enough food to eating, no problems. Yeah, no problems. But their absorption functions is poor. So that not like some people getting some digestion systems issue. There are poor absorptions. They eating normally, but they still got poor nutrition. And also, like they couldn't effect it to transform nutrition to the bodies. So that's another reason. Or even they transfer to the body, they hard to use it. So when nutrition, we know all the nutrition coming from our food. The food firstly go to our digestion systems, go to stomach, go to small intestine. Like last semester, we especially talking about, we have three big nutritions, like starch, chemical digestion in the mouth, protein, chemical digestion start from the stomach, and fat, chemical digestion start from the small intestine with the bile helps. All of these nutritions after digestion, especially chemical digestion, they will be absorptions. Absorptions means sending nutrition to the blood. That mainly happens in small intestine. And from small intestine, they mainly through the blood sending to the liver, and from the liver sending to all over the body. That's the mainly part. So any part in here, they have some disorder. The body will not get enough nutrition. So that's basically we're talking about deficiency. We're talking about deficiency. So that kind of nutrition, we say we mainly have three big nutrition. Yeah. Carbohydrate, protein, and fatty. Also including some vitamins. Also some like irons, minerals. So all used for our normal body functions. So that's basically we're talking about. People may have like all the nutrition deficiency, may have only one aspect nutrition deficiency. For example, if patient iron deficiency, that's possible cause a special kind of pneumonia, like their red blood cells level is pretty low, and the hemoglobin level pretty low. That means they couldn't transform nutrition, couldn't transform oxygen to all over the body. And sometimes people may not only have one kind of nutrition deficiency, they may have a lot of nutrition deficiency. So that's truly their organs functions decreased because they don't have enough nutrition. So that's deficiency aspect. Then we're talking about like nutrition excessive. So in the modern life, look like more and more people, they got some more problems with like getting weight, oversize is getting weight. So that means people eating too much compared with the need or the use. So certainly, when you're eating too much, but you are not to do too much physical activities or exercises, all the nutrition will stay in the bodies and will getting body weight gradually increase. So body weight increased or oversized truly caused other sick or illness. Like these kind of patients pretty easily got diabetes. Generally speaking, we have two different types of diabetes. Type 1 is caused by genetic reason. Thus, we're talking about like family members have similar situation like diabetes. Their children pretty easily got diabetes. They got illness pretty young. And the whole life, they need injections for the insulin because their pancreas couldn't produce insulin. We're talking about inside the pancreas. Part of the pancreas belong to digestion systems. Another part pancreas, small amount, but a big function in there. Thus, especially beta cell producing insulin, because they have some disorder genetically, their beta cell not able to produce enough insulin. So that's whole life. There must be injections for insulin. So that's for type 1 diabetes. Type 1 diabetes. But type 2 diabetes, type 2 diabetes is environment reasons. So these environment reasons relationship, pretty close relationship, people getting overweight, obesity. So these kind of patient, diabetes, truly they can by control the food they eating, and they getting kind of degree reliefs. That not severe kind of patient, truly just control the food they eating, they will cure it. Is this kind of patient not necessarily start from insulin injections, but if they are not control their food eating, later on they may still need insulin or other medication or drugs. So that's this kind of illness relationship with people over body weight or obesity. And another illness, high blood pressure, also relationship people getting overweight. So because patient overweight or obesity, so that means all of the body cells, they need nutrition, they need oxygen. So how the oxygen and the nutrition sending to the body cells? So that's truly need more blood circulation to there. So our heart pump the blood to the circulations. So they need blood pressure to holding their maintenance there and then send the nutrition to them. So that's caused the two problems. One problem is heart overworking. And because patient overweight, local tissues pressure is increased. So if blood try to send in there, the blood pressure will be increased. Otherwise, they are not able to moving blood sending to the local and sending to that big area. And when blood pressure increased, heart even need jumping more powerful. Otherwise, because blood pressure is higher there, the heart need more pressure inside of the heart cavity also. So that also causes the heart disorder, heart illness. So people overweight or obesity truly cause lot of troubles. It's not only overweight. It's not like people say, I don't care what I look like. I just eating whatever I like, but still don't like to do too much exercise. So that's truly cause the other issue or other problems. So that's nutrition. Nutrition can cause the illness from two aspects. One aspect is deficiency. Another aspect is excessive. It not means excessive is good. Still cause trouble. Then we're talking about infections disorder. So basically, this kind of illness caused by microorganisms. What means microorganism? Means that small living stuff, we call it organism. We couldn't generally say we couldn't see with our eyes directly. We must be use microscope, then we can see it. So these kind of microorganisms, including virus. Virus is the smallest one right now. We're talking about can cause people sick or illness, can cause the infections. Directly right now, we're talking about COVID-19. What means COVID-19? Just a special kind of virus. That's their shape. Because the shapes look like some corn there. So that's the name coming from. And they found it in 2019. That's the name coming from. So virus truly cause the infection kind of illness. Some illness pretty severe. Yeah, it's not only COVID-19 cause the infection right now, like hepatitis, HIV. That's all belong to virus, and the virus infections cause illness. Another microorganism, we say bacteria. Bacteria, little bigger compared with the virus, but still pretty small. We still need to use microscope, then we can see it. Otherwise, we couldn't see it. So that's we have a lot of illness can caused by bacteria, like pneumonia, skin infection, meningitis. Yeah, we have a lot of. And the fungi. Yeah, fungi usually is not that common compared with virus and bacteria, but still cause people illness. Like some people have skin infection, nail infection by the fungi. And in some special kind of case, the fungi can cause the infection of the lungs. Usually, we talk about the lung infection, mostly is caused by bacteria or maybe caused by the virus. But truly, sometimes fungi. And we also have some other microorganisms, a little bit bigger even than fungi, that also can cause the illness. So these kind of microorganisms, they invading the peoples, with different way. So the common way, respiration by the air. Like patients, they got some infections, maybe virus, maybe bacterial, especially we talk about COVID-19. That's mainly transformed by the air. So the patients cough, sneezing, even they talk, because the virus is pretty smaller. They will follow people talk, cough, respirations, they coming out to the air. And if people too close to each other and respiration take this kind of virus go in, they will get virus reproduction inside the bodies and then cause the people sick. So that's the mainly we talking about air transmissions. So some virus, some bacteria, they transmission by the air. So these kind of illness, when we prevent it, certainly mask is the best way. Cover patient's mouth and nose, and cover all mouth and nose. So that's like preventing the virus or bacterial transmission from one people to another people. Another transmission way for microorganisms, like by our digestion systems. So like directly touching, patient touching some material, and then other people touching. Or maybe patient handles the food and other people eat it. Or maybe prepare some water, other people drink it, then cause the disorder. So these kind of illness mainly prevention with hand washing. And if people have sick or illness, like transmission mainly by the digestion systems, 出来, they will not allow to prepare food for others. So that's another way. And we also have some special way the microorganism can transforming from one people to another people by the blood. So like hepatitis B, HIV. So that's all the transforming by the blood. So like people use the same needles, that's pretty easily transforming the illness from one person to another person. Also, when we do acupuncture, when we do needling, pretty be careful the needles. Like after we withdraw the needles from the patients, don't make the needle stick for us, for the fingers sometimes. Still possible transforming. So that's blood transforming kind of illness. Basically, right now, we just protected of ourselves, not like touching other people's blood for anything. So that's blood transforming. Blood transforming kind of illness also possible by like mosquitoes. So mosquito beating some patient and then they beating other people. They still possible. So that's still some special way. And certainly we have some other ways like sex transmissions and some illness transmission from moms to the babies. So we have a lot of ways can transmission, like a microorganism cause the illness. But these kind of illness 出来, we need more pay attention for preventing. So we say hand washing, usually we mainly focus on some illness directly touching, like the digestion systems transmitting. But 出来 for other ways still working. Like right now, we're still talking about hand washing for COVID-19 preventing. Because if your hand touching some like a superficial of the like a desk or whatever, your hand possible have virus there. And pretty commonly people use the hand touching the face. And if you're touching your face, that's still possible the virus go to inside the body. Like we say, possible coming from the nose, possible coming from the mouth, and some case even from the eyes. So that's we still say hand washing. So for all of the illness preventing. So that's infection kind of illness. Infection kind of illness. Then we're talking about the immunity disorder. Immunity kind of reasons cause the illness. Immunity. a disorder, we still separate a few parts. One part we talking about hypersensitivity reactions. So that's like asthma or people allergy. So that's basically our immunity systems is normally protected of ourselves. Means something coming from outside, our immunity try to relieve it, reaction to it. So that's normal reaction. Hypersensitivity means something coming outside, truly not that directly damage our body, but our body is thinking about that's possible will be damage our body. Then overreactions, so like allergy reactions for the pollen, and then cause a lot of symptoms. So that's we say hypersensitivity reaction. Then another aspect is a deficiency reaction. Something coming from outside is not good for our bodies. So like if normal function, like immunity function normal, will protect it of ourselves, like some microorganisms invading. If our immunity system is strong, will protect itself, not get the sick or illness. But for some people, if their immunity system is weaker, so truly is easily get sick or illness. So we have some reasons can cause people immunity systems deficiency. But truly we have a special kind of virus that we call HIV. HIV is the virus name. And the special cause the illness name is S. That means acute immunity deficiency syndrome. Means it's not naturally immunity deficiency. It's caused by other reasons. The other reasons here is virus infection. Because this kind of virus especially against of our body's immunity systems, the cells, and then cause the immunity deficiency. So that's two aspects. One is too sensitive, one is deficiency. We have another special kind of situation. We call it autoimmunity. What means autoimmunity? So we say our immunity systems should be protective of ourselves. So something coming from outside the body, like a virus, like bacteria, then our immunity systems will be against it, to kill them, to relieve it. But for some reasons, we're talking about illness can cause by different reasons. but for some reasons, the body immunity systems make some mistake. They will against itself, like the cells, the tissues. So that's still kind of hypersensitivity kind of reactions, but just special kind of hypersensitivity reactions. So that's the immunity systems against itself, cells and the tissues. So one example we talked about before, we talking about type 1 diabetes. We say type 1 diabetes belong to the reason like a genetic reason in bigger category. But truly what happens there? It happens the people's immunity disorder caused autoimmunity, and then they broken the beta cells. We say beta cells is pretty important. They can produce insulin. They are located in the inside of pancreas. When immunity killed beta cells, certainly they will not produce insulin. And insulin functions decrease blood sugar level. We say blood sugar level should be kept in some range there. Too high, too low will cause the severe kind of situations. People suddenly blood sugar level is dripping down. People maybe start from weakness and later are getting severe. Even severe case, they possible losing consciousness, like fainting. Blood sugar level is higher, cause other severe kind of issue. For the sugar's metabolism, during the metabolism, they will generate kind of chemicals. That kind of chemicals will be kind of a toxin if they are not metabolized properly. So that could be toxin reactions. And also long-term patients' sugar level is too high, will damage blood vessels and damage different tissues. So that's we talking about some diabetes kind of patients. They may have eye problems. They may easily get infections, like bacterial infections, because bacteria still use sugars like energy. If blood sugar level is high and the tissues, blood circulation to tissues, their sugars level still high, and the bacteria is easily to living there. So that's caused a lot of problems. So that's we say autoimmunity disorder. Still another severe kind of situation. We have a lot of illness relationship with autoimmunity disorder. Then we talking about mental stress. mental stress, recent years maybe caused more problems, like people depressed, anxiety. That's truly still belong to illness. Yeah. So these kind of patient, like their mental stress for long term, truly affected, like their lifestyle and people mental stress. They couldn't sleep well. They couldn't eat well. They caused like a fatigue. They couldn't do any kind of activities. So that's we still need to pay attention for the mental aspect. That still can cause the illness. So that's totally 6 here. We're talking about the illness caused by environmental reasons. 6 aspects: physical, chemical, nutrition, infections, immunity disorder, and mental disorder. So from the beginning, we're talking about illness. We separate with 2 categories can caused by the different reasons. The first category is environmental reasons. We say we have 6 there. Then we go to genetic reasons. Genetic reason we say genes disorder. Yeah, genes disorder. It's transforming from parents or even grandparents. So certainly grandparents genes passing to the parents. So that's genetic reason. Yeah. Genetic reason transforming for illness. For different, we have different patterns. We know everybody's cells have 23 pair of the chromosome. And each of the chromosome, they have million of the genes on there. Yeah. So that's truly by genes transmission of the illness. We're talking about the self-division before. Yeah. Self-division, we say for reproduction cells. So reproduction cells, the way they division, they form 23 single cells for reproductive cells. Like this side is mom's. Together is the whole mom's gene. And this side is dad's. So still 23 single. The combination way may be different. They may be like we talking about this A, this B, this C, this D. Just for our easily understanding. Yeah, we just name it. Yeah, just name it. So they may come in like A with C, AC here. They may come in with AD here, they possible forming BC here. They possible forming BD here. So right now, look like we only have 4 different kind of type, like cells, reproduction cells, and reproductive cells combination coming from the moms and dads. But truly, when cells divisions from the mom cells to 2 cells here, the process, when they make a copy, they will not exactly with the mom cells because the genes will be changing. So we have millions possible. Yeah. So if mom have genes problems, we don't know they go to which cells there are genes in there. So if they go to A here, so if combination AB or AD, their children will have sick. But if their sick gene in A, not in B, so that means BC, BD children will not sick. So that's we're talking about for genes disorder, like in the families. They have some boy, some girl, and some boy they have sick, some girl they may sick, other boy or girl may not sick. So more complicated, more complicated. And some illness especially follow sex genes, That's why some genetic illness especially go to different genders. So we are not go to that detail for genetic reasons, but just give you some basic idea, like genetic illness. What happens? What happens? So that's all talking about the cause of the illness part. So still go back for pretty beginning. We're talking about etiology. Etiology. So etiology, we say we have the illness reason we know what's caused. One big category is the environmental reason. Another big category is the genetic reason. And the environmental reason, we have 6 there. So that's the part we finished. Now we're talking about the illness development part. So illness development part, we also can use the words cause of the illness. So cause of the illness means when we're touching some special reasons or exposure for some special reasons, and how illness gradually development. Certainly not all the illness finally will cause people die, but some severe kind of illness possible cause patients die. So they may have some time after exposure to the reason cause the illness. Like we say, people touching with like other people getting sick. They don't know. Like we still say COVID-19, so popular right now. So some people, like a meeting, they go to some party, meeting some other people. They don't know the other people have sick. Even the patient itself don't know they have COVID-19 infection. Then in the bigger party, lot of people together there. And then like after party. So that's the time exposure to the some dangerous situation or risk situations. Then after party, we know one of the people in this party, they may got a COVID-19 infection positive. But the other people during that time, they didn't have symptoms. So that time we call it lattice period. And then they will have some changing. Small changing happens inside the body, then clinical kind of changing means symptoms and the signs show up in the body. And then cause the severe damage, and the severe case will be death. Certainly, people possible recover for the different stage. Yeah. Even clinical on-site, like after some treatment, they still recover. Some people after treatment, they mainly symptoms recovered, but they still possible leaving some like a body damage part. Like we talking about some people got COVID-19 infection and they losing their smelling function and losing their tasting function. Some people recovered, some people still not recover, and some people died. So that's the basically process of the illness or core of the illness. So that's basically we're talking about here. If we get some risk, exposure to some risk, and after some time, like nothing show up, but truly they got some like illness factors invading of the bodies. And biology on site, this is the time somebody like in the cells level or tissue level, it is some changing in there already. But people didn't see the symptoms and the signs. So that's the first changing start from the cells level. That we call biology on site. And follow the biology on site. That's mainly clinical symptoms will show up. So that's talking about how the illness development. When clinical on-site time, those people know they are sick because they have symptoms, because they have signs. We still say symptoms is the people feel it, and the signs is the other people examinations find it, looking find it. So that's the on-site. So we say most people will be recovered in different stage, Maybe biology on site, like people recovered. They even don't know they have sick or illness before. And clinical on site, then they recover. They have symptoms. They have signs. They know they recovered. But some people maybe got chronic damage. Some severe case, people will be dead. So we say some people possible naturally recover. What means naturally recover? Means basically their immunity function is pretty strong. It's not truly with treatment. They recovered by itself. That's still possible for some sick or illness. People possible can naturally recover because their immunity function is pretty strong there. Then we're talking about some severe case. We say when they go to the clinical on-site time, they have some possible, they just recovered. And like naturally recovered, living without any kind of symptoms or signs. Generally, we can think about totally recover. And some people, they may get a kind of recover, but may possibly leaving some other symptoms or signs in there. For example, we talk about the stroke. With stroke kind of people, we know in the acute stage, like people possible suddenly losing consciousness, and like their blood pressure pretty high, and they couldn't move in their bodies. They couldn't do anything, and then sending to hospital and treating in there, and the next day they wake up. But they possible half the body totally couldn't move. Even after few months treatment, their body, half of the body, still couldn't move. So this kind of situation, we say sacred. That's the means. The acute stage is recovered, but they still have some symptoms or signs in there, not totally recovered. And most cases it's hard to totally recover. And certainly some people may be dead. Severe kind of case. So that's about the illness causes or development of the illness. And we say severe kind of case, patient will be dead, but we still separate two different kind of death. One kind of death we call it clinical death. Another kind of death we call it biological kind of death. So what's the difference? Yeah, what's the difference? So clinical death, clinical death. Generally speaking, last time we talking about maybe their pulse is stop beating, no pulse and no blood pressure. Last time, and the pupils getting wider, dilate. But basically this time, we're talking about respiration stopped, circulation stopped, and even brain stopped. But clinical death is reversible. So thus we can try to save the patients like with special kind of save the recovered function of the respiration, recovered circulations, and thus reversible. People can still back to life. So this we talking about reversible here is possible, but not every patient will be recovered from that stage. If not recover from that stage, then we're talking about biological kind of death. So that's truly people death, irreversible. So if go to that stage, truly people couldn't recover. So that's truly including circulation, respiration function totally stopped, brain function totally stopped, and all the body function totally stopped. So that usually happens after clinical death. So we say clinical death is reversible, but still it only happens for some usually is acute kind of situation or acute kind of problems. Like people get, we talking about some reason caused illness. One reason is electrical. Some people directly touching to electrical, and then the respiration stopped, circulation stopped. But after we immediately try to save the people's life, people possible from the death stage and recover. And also some people falling down to the ocean, to the water, and after we saved the people and found respiration stopped, circulation stopped. But if we immediately and get some people treatment, it's possible, reversible. But if after long term, that's truly patient can go to the stage of biological kind of death. So that's two words we use for the death.